Welcome back to Patient Advocacy Initiatives, a nonprofit educational organization. I'm Dr. Michael Warner, here to help you be your own best patient advocate. Second in our series, what if you see something in your healthcare record that did not happen? There's a high chance that when you look at your healthcare record, you're going to find something in there that shouldn't be, or you're going to find something that's wrong. Where did it come from? Well, it could either be wrong chart, a mistake, or it could be true. We know from government reports that medical providers can type away on an electronic health record system. They're working on their computer, thinking of one patient, but sometimes the information is in the wrong person's chart, and that happens. Also, there are times when a report, an x-ray, a lab test can come in and it can get scanned and put into the electronic health system, and it can be done into the wrong person's chart. That's why you want to watch your records and you want to make sure that information is correct and about you. There are also times when it's a mistake. It might just be a mistake. You might go to the doctor and complain of right shoulder pain, and throughout the record it says left shoulder pain. That's particularly important if you're about to get an MRI of the wrong shoulder. Template and copy forward functions are part of the electronic health record system. A template allows me to put maybe a paragraph of information in quickly with just a couple keystrokes. Perhaps I'm trying to describe something about cholesterol to you or diabetes. This allows me to give you that information. Some people think we should get rid of templates, but they're good. If I had to sit there and type the whole thing out, I'm sure I wouldn't remember all the details. But sometimes templates can go a little bit too far. If I'm using a template describing a detailed knee examination, it may say that I did an exam on both knees, but I only did it on one. So we can watch for those. Copy forward is a function that allows me to take something from a previous visit and move it to this visit. Let's say somebody has a heart murmur and it has an unusual sound to it. I may have described it last time, and if this time it's the same, I might want to copy forward that description rather than retype it into the computer. The problem is if at the last visit you also had a red eardrum, that would also get copy forwarded. The last reason is that it may be true, and sometimes it may be trivial. Let's say you had an echocardiogram done. It's a scan of your heart, and it shows mild mitral insufficiency. That may not mean anything towards your health, but it'll show up as a diagnosis, and when you first see it, it may alarm you. The corrective action, should you find a mistake, is to contact your office. And you can do it by phone, you can use your patient portal, there's a messaging service in there, or you can use a prehistory. The problem with the phone is that you're going to get someone on the phone, and what are you going to say? Hey, this is wrong, you got to change that. Good luck. If your MRI is about to be done on the wrong shoulder, then you definitely want to call by phone because it needs to be changed. But if it's something else in your chart that can wait, you're probably better off doing it in writing. The portal allows you to do messages, but if you send that message in, it's pretty much the practitioner that only has the ability to edit a note. So you don't want to send a bunch of messages to the doctor about how the spelling was incorrect or some other small detail in your chart. You're best off making all corrections with a prehistory. We're going to show you how to review your history, your exam, and also your medical decision making so that you can write your own story and set the story straight. You can explain what's going on with you, and if there are any mistakes, you can correct them at your next office visit using a prehistory. We'll talk about that in our next few lectures, and I also want to tell you that you could go to patientadvocacyinitiatives.org for more information. You can follow the rest of our videos. You can friend us on Facebook, and we also have everything in our guidebook, Rise of the Patient Advocate, available on Amazon. Thank you very much.